Bismillahirrahmanirrahim. Assalamu alaikum, and welcome to the fantastic panel that has agreed to be part of this conversation today for Tabadlab Live. I'm Musharraf Zaidi. I'm a senior fellow at Tabadlab, and we're really delighted to be joined by, I think, an enlightened and vastly experienced and knowledgeable group of people to talk a little bit about the Ehsaas Emergency Cash program and what it might actually mean in terms of its implications for both the social contract in Pakistan, the fiscal priorities of the country, and particularly as we move forward into the future, what kinds of digital opportunities might lie in the execution of this grand idea. The Ehsaas Emergency Cash program is a income support for Pakistanis that are impacted by COVID-19. It's a 12,000 rupee one-time cash grant that will be made to eventually 12 million households. Out of those 12 million, over 2 million have already been, the cash grants have already been dispersed. The panel of discussants that we have with us today have worked on this, written about it, thought about it, either very recently or in almost all cases for many, many years. We're delighted to be joined by Mudassar Aqil, who's the CEO of Telenor Microfinance Bank, which also includes the Easy Pesa product, which is the primary digital cash or digital payment instrument in the country. We're delighted to be joined by Nazish Brohi, who's a social scientist and a researcher who's been working in development and public policy, particularly on issues related to poverty for many years. We're delighted to be joined by the CEO of the Rural Support Program Network, Shandana Khan. We're delighted to be joined by Juvaria Jafri, who is a researcher and a scholar at the City University in London. And we're also delighted to be joined by last but certainly not least, Dr. Pervez Tahir, the former chief economist for the government of Pakistan and a commentator. Dr. Tahir, we'll get started with you. You recently wrote a piece which I think struck quite a few chords, certainly with me, but I know with many others that I spoke to about that piece, the piece for the Express Tribune, in which you said, lots of questions for the poor, but none for the rich. Whilst obviously that sentiment does strike a chord, I also felt maybe it was a little bit unfair because actually as cash transfers go and cash grants go, Pakistan was able to put together a very big program very quickly. Do you not share the excitement that certainly I have as to the transformational potential of such a large cash grant that's been deployed so quickly? We've already had 2 million payments made. Dr. Tahir?
Thank you. I think we should know that this program existed already. The database was already there, and some budget allocation, this 144 billion, was already budgeted. There was nothing new in it. In fact, they wasted time. They could have started with the existing recipients on day one. That is the kind of logistics that has developed over time. I'm a great admirer of BISP. I was involved in it, and I have always believed unconditional cash transfers are necessary in this country. That is why I am worried about these questions being asked. You are asked no questions if you want an export rebate. You are asked no questions if you sort of have not paid your taxes and yet you are a big wealth holder. And asking questions, too many questions for eligibility in a period of crisis, especially a pandemic-like crisis, is actually unfair. You see, the people who applied in the first instance, my calculation shows they were all in some sense affected. You know, there may be 5 or 6% who were lying or whatever, but you could have quickly transferred a lot of money. And I also have questions about the mechanism. You know, most people use Easy Paisa or Jazz Cash or things like that. You didn't need these queues. You could have just sent money to the people. You know, now they say some 60 million text messages were received. In fact, even there, they can't even count their text messages. In the beginning, they said 30 million, then 35 million, and now it is coming out, it was 60 million. Now that's about the poor people below poverty line and those who are vulnerable. That is roughly the number of the deserving people in this country. You did not need to ask questions. In fact, the entire 1.2 trillion rupees package announced should have been disbursed to these people. There, there are no exports to make, there is no investment to make, there is no climate for it. The only thing that you need in the formal sector is to protect organized labor, and we have done nothing for that. Thank you.
So, thank you, Dr. Tahir. That's, I think, starting off with a bang. I think, as far as my understanding of the program is concerned, the 4.5 million existing recipients of the BISP or the Ehsaas Kifalat program, they automatically qualify. And then I think one thing, there's two other sort of floors or ceilings, however you want to define it. One is that the NSER people that are on the National Socioeconomic Registry that did not qualify previously because of the calculated household income, that threshold was lowered so that another 4 million people would qualify. So that would make it 8.5 million. And then I think another 3.5 million would add up to 12. That 3.5 million is what the SMS campaign was trying to solicit for. I do see the sentiment, and actually I find it an important part of the conversation. When we don't ask difficult questions for export rebates or for the construction sector, then why having poor people jump through so many hoops? But some of it is maybe necessary procedure. Juvaria, maybe you can sort of respond to that and also talk a little bit about financial inclusion writ large.
Yeah, sure. So I think Dr. Saab has actually covered quite a bit of what I would have said on the social contract part of your sort of list of themes, right? My question, which I actually just couldn't find anywhere online on the Ehsaas or and any of the sort of government pages, was on what the eligibility criteria actually is. So from the YouTube videos of Dr. Sania Nishtar, it seemed that the criteria about travel history and owning a vehicle and so on still applies. So yeah, I just wanted to see if that's actually been relaxed, but I really couldn't find any clarity. So maybe somebody over here can speak a little about that. But yeah, absolutely. I was also surprised about them not using the Easy Paisa network, or sort of making a more easy distribution strategy. But yeah, aside from that, I think I think it is important to sort of talk about this fixation with who qualifies and who doesn't qualify, and this this emphasis on ensuring that people who aren't entitled actually don't wind up using this. But on the fiscal priority bit, I think it's really important to sort of talk about the infrastructure versus the actual fiscal capacity, right? Because right now this is all up in the air, right? There is going to eventually be massive relief programs that come from the IMF and the World Bank. They haven't, there's talk of issuing SDRs. They're talking about sort of debt relief for the poorest countries, but they'll probably be extended. And if they do issue the SDRs, and that means a lot of the issuance actually goes to the wealthy countries, the OECD countries, and so on. And I think the moral imperative for them will be to just transfer it back to the poorer countries. So there is quite, I think the fiscal space issue is getting too much emphasis right now. And as long as the infrastructure is set up, there will be sort of plenty of opportunity to ask for funding. On the digital transformation, but I just wanted to talk a little bit about the security and the privacy aspect of it, right? So it is quite effective right now to have people sort of text in and be added to this massive database, right? And other countries are doing it as well. But there are so many questions now about how this data is to be stored. How secure is it? What is it actually going to be used for? Is there any sort of legal framework or legislation to protect the rights of these people who are voluntarily adding themselves to this database, right? And you're creating this massive inequality over here because only some people need to be added, right? So some of us are fine not being on this radar, but for others that's not an option. So I think that's quite concerning. It's also quite concerning to see that there isn't actually any provision for cybersecurity. I mean, this could easily be hacked. This is a massive database, and there is sort of no ruling on data privacy and regulation, right? The citizen feedback part, I just wanted to see if there's any sort of material or discussion on recourse, right? So what happens if you send in a text and you're not eligible? Is there, like, what is the mechanism through which you can contest that, through which you can ask for your inclusion, through which your data might have been misentered or misused? But yeah, I mean, those are sort of my concerns and the areas that I'd be more interested in learning about.
I think what you've just said, Juvaria, is a great segue into maybe asking Shandana to take the floor and talk a little bit about this database, its origin, its evolution, and maybe also address some of the concerns that Juvaria has just mentioned.
Okay, thank you. I think I need to begin by saying that it's really a very impressive effort that Dr. Sania has undertaken. And I think that the speed with which she's done it and the turnaround is really impressive. It's a very, very large task. Now, as we know, over 4 million of these clients are the BISP clients. And we were involved in the National Socioeconomic Registry, as were 4 other organizations. And we were meant to survey about 10 million households across the country. So that included all of ex-FATA, Gilgit-Baltistan, Khyber Pakhtunkhwa, all of Balochistan, and part of Sindh, which included Karachi, which was our biggest challenge. This exercise was still underway. Unfortunately, we ran into issues in this survey because there were technical issues in the BISP system of correcting errors. And we had, I must say, a very large percentage of errors when we collected the data, but we were not able to go back and fix it. So I'd be very interested to know that, what is the criteria that has been used to identify these clients? Because this BISP criteria is really the most watertight one that you have. I think probably what happened is because the survey ran into problems, that there were other filters then applied from NADRA and from other sources. And in this case, as we've just heard, things like, is your phone bill over 1,000 rupees? Are you traveling? And that's some of the criteria that was applied to BISP clients earlier when the 800,000 clients were weeded out. But I think this is very important, that how are these people being selected? Now, I'm not saying that the selection is wrong. I'm just saying that it needs clarity, that how is this happening and what database is really being used and how is it being used. At the other end of the spectrum are the people we work with, and we see who is registering, and we're helping with registering. I think we must realize that everybody doesn't have the types of phones that can download this package and register. I mean, our staff have been helping thousands and thousands of people just enter their names and CNICs on telephones just to do this. And this has been across the board, and we are in 135 districts. And where there are activists who do have Androids, community activists, we have said to them that please, start registering people. So that is one thing that we have been doing on a very, very large scale. And of course, then comes the issue of actually getting the cash. Now, in that, some district governments have approached us that they were not able to control the crowd, and that they want community activists and organizations that we have worked with to help, the women police or the police in doing distancing, etc., for future disbursements. This has not happened everywhere. This has happened in some places. I think if you look at it overall, I think it's been very impressive how this has been turned out by Dr. Sania Nishtar. But I think these questions are important. The third point I'd like to make is that there is a 3 to 4%, and I'm basing this on surveys that we've done, of people who may not be BISP clients and who may be left out of this cash transfer. These are people who do not have CNICs. So how do we get to these people? A lot of them are mobile, so they're either nomads. If you look at Sindh, it is labor, which is it is Haris who move from place to place. I was just looking at some of the data that we have for Sindh, where we did initial surveys 3 years ago, and it's 91% of people work outside the home which is off-farm labor. Now, how many of those actually have CNICs? We've calculated that about 3 to 4% of the poorest, that means falling in the 0 to 23 poverty scorecard band, which is the scorecard that is used by BISP, that they do not have CNICs. Now, this is what we constantly offer to the government is this, that we can help access those poorest if they are members of community organizations. So I think this large network needs to assist and complement what government is doing. And it is very simple for us to do this. So you have a criteria which is, very structured in terms of, these grants being awarded on a certain basis. But I think, the district governments and the provincial and certainly Ehsaas also need to look at these people who are being left out. The district governments, I must add, have our activists and RSPs on committees. There are 510 committees and task forces on which we are present. And what are they asking us? They are saying, please get from these villages the list of the poorest. This is for to be used for any zakat grants, to give rations, etc. So I think we need to look at both ways of doing things to access those that are left out.
Thank you, Shandana. That's really helpful. So one of the other speakers that I had invited, but because he was traveling, unfortunately, and his connectivity was compromised. Nazish, I'm bringing this to you, but I just to talk about Mohammad Salim's PhD thesis. Salim is a scholar and has worked in government, and he finished his PhD recently from Erasmus University, and his PhD thesis was on the selection methodology. It's interesting what Shandana just said about how district governments are asking RSP activists and community mobilizers to help identify who the poorest of the poor are, because in many ways that model is reminiscent of the original intervention. The first time in 2008 and 9, when BISP was essentially formed, the identification of the deserving candidates was through politicians, through provincial and national members of assembly. Of course, there's a school of thought, perfectly legitimate, not one that I agree with, but perfectly legitimate, that believes that that is problematic. Salim's research suggests that actually, at least in the test UCs that he was looking at, that actually was a much more effective way of identifying the poorest of the poor. Nazish, I wonder maybe if you want to start off with the how to choose who is deserving and who is not in this conversation, not just right now today for Ehsaas Emergency Cash, but writ large, from the BISP program to its transition into this larger Ehsaas effort that we see today.
Well, I'll agree with Pervez Tahir Saab on something, and that is that you don't filter in the middle of a pandemic. You don't have the breathing space to filter. So I think it's important to talk about transparency issues and who the deserving are, but I think there's a time for it. I think it makes sense to just roll it out as widely as you can right now, and then maybe filter out people at some other point. We do see a lot of concern around it, but to the point I think that the concern tends to veer also a little bit into this elite hostility for large scale measures, and it's not really just Pakistan. So I mean, all of us will remember when the BISP first rolled out, there was such a reaction in Pakistan that PPP will give it to its own voters, and these people are just going to sit there on roadsides and just sit there with this money. We see this kind of mirroring the kind of discussions that have happened globally, where people say, if you give people, free money, they're going to use it on drugs or alcohol, or they'll stop working and they'll become lazy. So there is this kind of, conservative economist view. So that does have a kind of global validity. But at the same time, I just also want to point out right now that there's also another side of the argument. And that's not just specific to the novel coronavirus pandemic situation we're seeing right now. There has been a global conversation happening about, for instance, universal basic income. And we've been hearing about it now since the 1930s. Iran rolled it out in 2010. They already have a universal basic income program. So my point is that we need to, I think it's also look at what's going to be happening long term, because the previous conversation around, such kind of unconditional cash transfers was not kind of rooted as much in a pandemic situation, but in a redundancy situation, because there is an anticipation that there'll be mass level redundancies, not just because of this, but because of automation, because, what does 3D printing do to your factory labor, for example? So what does automation do to the job market? So I think at some level, we need to start thinking about this as a more permanent feature and not just a one-time cash transfer. It is entirely possible that this whole situation has expedited a conversation that would need to have happened in any case. So I just want to kind of flag that we do need to look at whether this is something that needs to have staying power. We're seeing conversations happen around it at a policy level across the globe. Some silly things. Chatham House, for instance, is calling it PQE, people's quantitative easing, because they don't want to say universal income. So I mean, you can call it what you want. You can call it the Ehsaas program. You can call it BISP. You can call it whatever kind of resonates with your ideological economic universe. But this is a crisis where the state needs to look out for its citizens, and we need to kind of find the best mechanisms for it. Around database, we have the BISP database is actually very good. I mean, in terms of, I'm not saying everybody in it is deserving or not. I'm not even getting into that conversation, but I'm saying there is a ground not as much network, but information base that we have about what constitutes the poorest of the poor. Prior to this program, we didn't know. We've just finished an extremely expensive census program. So we have now a census after 18 years. We still don't know. I mean, we're still saying we need more data. I don't know why we need more data. I don't know why we're not able to better utilize the data sets that we already have. And I'm glad you have someone sitting here, the CEO of Easy Pesa, because I mean, this shows you that we don't need to start from scratch each time and say, oh, we've been hit by this crisis. Now we need to kind of grapple and, reinvent the wheel and start things from scratch. So in that sense, it's good that we're scaling up the BISP. We need to kind of turn around the data faster and get over the kind of hostility that we find usually on programs that specifically target the poor, whether it's, the health workers program, whether it's the utility stores, whatever it is, because we have we all know the state of Pakistan's, poverty, which we've seen has kind of become better over the years, barring Balochistan, but everything's barring Balochistan. But we've seen the poverty indicators kind of fall, we've seen it improve, but we also use metrics, for instance, such as unemployment. And if you look at Pakistan's unemployment, it's fairly low, but we also know that's a very misleading thing, because unemployment emerged in a post-war context where there were more formal economies, where there was unemployment benefits. We don't have any of that. What we do have is chronic severe underemployment. And if we start looking at who makes a livable wage, pretty much it would give a very, very different figure. So anyway, my point really is to not filter right now, to reach out to whoever you can. And you know what, if there are 3%, 4%, 5% of people who are undeserving, I don't even know what undeserving means. Everybody needs to eat food. Maybe they can just pass it on. Maybe we can have some way of doing that, or it's all right. There are all programs that have some margin of error, and I don't think we need to stall on that. I don't think we can afford to stall on things like that to kind of reduce the margin of error. We need to, at some point, look at how to institutionalize this long term. I think we will have to do it in any case, to not look at it as a one-time program, to figure out how can this have staying power, which will mean tough decisions. It will have severe budgetary implications, and not just a one-time 2% of the GDP thing. We're going to have to make tough decisions, such as cutting down non-development expenditures in the budget. And that's a conversation we will need to have, if not right now, then in a few months from now.
Fantastic. I think, again, a great segue for Mudassar. I mean, there's a lot there for you to chew on, Mudassar, and I was really excited, just like Nazish, that you're part of the conversation, because this conversation is ultimately a technology conversation. What is the answer that you give to people who say, "Aap kya baatein kar rahe ho? What are you guys talking about? These poor people, they don't have iPhones, they don't have Samsung S20s. How are they going to be able to access digital cash?" So I wonder if you could do like a digital payments for dummies, kind of a starting point, a 101 primer on what the existing scope is. How many of the people who were standing in those really impressive lines, I agree with Shandana. I think the district administrations and the Ehsaas program need to be lauded. The BISP team, everybody involved need to be celebrated for how well organized those lines were and those distribution centers were. But did we really need those distribution centers? And if we did, what could it have looked like if more technology had been at play?
Yeah, I mean, I'd like to start by first acknowledging that what a mammoth challenge it is for the government. So, we must give them some due credit also, that in a very short amount of time, in considering all the political pressure and the media pressure, they had to do something that was probably the safest option. So I think they went with, the comfort zone and a tried and tested sort of a mechanism that they felt comfortable with. Now, having said that, we did advise them, and we are still in conversations with the government, that it's probably okay for the first phase, but this should not be a permanent strategy at all. And for the right reasons. I mean, obviously, the least of it, I think, is the long lines and the some of the footage that we're seeing on the media, that people pushing each other, no social distancing. Obviously, that has an impact of spreading the virus. But beyond that, I think this is such a unique opportunity for Pakistan, with these kind of incentives available to change the user and the market behavior permanently towards documentation of our economy. So that's this opportunity we must not lose sight of. And in terms of technology, the question you asked, Pakistan has now, I think, 165 million SIMs that are activated. Once we account for the multiple SIM usage, there is consensus that we have more than 100 million unique SIM users in Pakistan. So we've got a pretty decent coverage in terms of people who are using a mobile SIM. We understand that there is disparity between men versus women. So women have less access to a mobile SIM than men. But the unique opportunity really is that when you combine the SIM with a CNIC, you've got a unique financial identity. And Pakistan, over the last many years, has gradually evolved into a very advanced infrastructure of mobile banking, which is now available, fully functional, scalable in Pakistan. So anyone who has a mobile SIM and a CNIC can actually open a mobile wallet on any kind of phone in less than a minute without going anywhere, without any biometric verification. So that's all available today. Then once that account is open, it can be used to receive money, send money without any kind of friction at all. So these base level functionality now exists for a long amount of time. This process is verified, tested, well over, I think, 15 million accounts have been opened already using this process. So this is a very, fairly safe option in our opinion.
Mudassar, just to reiterate, because I think this point is lost and a lot of people will be surprised to hear this. You said that it doesn't matter whether you're on a 2G dumb phone, so to speak, those small Nokia 3300 type of thingies, or an Apple iPhone, whatever, 12 Max, whatever the next version is. Either way, you're able to open a digital wallet. Is that what you said, and is that correct?
Absolutely. So there are two ways to open it. One is by typing in a string on a feature phone, like a 2G phone, and then on a smartphone you can download an app. So both work exactly the same way. Obviously, the app interface is a lot more enriched, so you can do more things. But for a base level user, the 2G phone functionality is adequate. Transfer money, do about 80-90% of the things. So my fear is that we are losing sight of this big opportunity, because once all of this is said and done, we will be back to exactly stating the same situation, the same problems that we have had from day one, again in the face. And there is so much. There's almost like a unnatural, forced adoption of digital services happening in the world today, right? Because people have simply no other option. So, and we are also learning in Pakistan that there are so many things that can be done in a very short amount of time when you don't really give people other options. When you do a lockdown, it's a lockdown. Then everybody is now trying to figure out how they're going to feed their children and how, medical services will be delivered, et cetera, all of this. So why can't we do this for financial services also? So it has been for far too long that banking or financial services has been a privilege, not a right, in this country and in most of the developing countries in the world. So this is a unique opportunity to fix that, because this is not just an ability to make payments, then it's a safe place to save, you can deliver insurance through it. And then most importantly, this lack of documentation problem that we continue to come back to. I mean, if we have to, in this day and age, recruit a volunteer force of hundreds and thousands of people who will be carrying, atta ke thele on their shoulders to deliver on people's doorsteps, it's as archaic as it gets. We've got now the entire digital plumbing in place that we can leverage. But we really need to do a couple of things. Number one, we need to push these money transfer kind of schemes through the mobile wallet plumbing. And then the next thing we need to do is to make sure that every retail enterprise in Pakistan that conducts any kind of B2C, like a business to consumer transaction, you mandate that they must accept a digital payment. And for the merchant also, it is just as simple. It's a 1-minute process. They open merchant wallet also with a high limit, and they're in business. So in my view, this is a unique opportunity and we must not waste it.
Thank you, Mudassar. That's a really thorough sort of treatment of the issue. Dr. Pervez Tahir, Shandana, I see that you have a point. Maybe why don't you raise that
later? I can do it later. Yeah.
Well, what I was going to do was I was going to bring it back to Dr. Tahir and ask him about the potency or the potential. You said the whole 1.2 billion, rather 1.2 trillion, should have actually gone out in payments. I think that without judging the likelihood of something like that happening, but what are the macroeconomic implications of making these payments? Suppose that every month, these 12 million people, suppose we made it like a normal thing, that every month 144 billion rupees goes out to these 12 million households. What would that do for the local microeconomies of the communities that are receiving these payments? And what would it do for the broader macroeconomy? Is there a macroeconomic argument for universal income support?
First of all, staying on this present crisis, throwing quickly 1.2 trillion rupees in the economy makes an economic sense. There is no other mechanism to give money to the people who can sort of spend next door in the corner shop. And you can also have SOPs for these shops. They don't need to be too many. And quickly, you will have some life in the economy. Otherwise, you can see even today, other than these rupees that are in the pockets of the people by now, about 2 million people, nothing has been disbursed. They're still talking about it. They're wasting time. That is number one. Now, coming back to the main point, we have to think about the future of work here. The way the economy is developing, the gig economy and so on, not everybody will have the traditional kind of work. So you have to sort of keep demand in the economy also. So it makes perfect macroeconomic sense to have a scheme of universal income for all. And I will again say, without checking anything, if you are rich, you don't want it, don't accept it. The point is that everybody should have some money in his or her pocket. That is number one. The present crisis is an opportunity. We are collecting, I am impressed, these 64 million people who sent text messages, they were actually judged against your NAGRA database for information. Now you have 60 million people who are part, in a strange sort of way, of the formal economy. You have information about them. You can make them part of any scheme that you have. And all this should actually be in a holistic manner. It is now established that you need one social security window. And you need two basic things in it. You need to take care of the old, and you need to take care of those who do not have work. There is no third category. Health system should be on its own and not the less than 1% of GDP that we have today. And that takes care of the society as a whole. About the fiscal implications, well, what is our fiscal economics? It is debt servicing, it is defense, and then we have a residual. That requires other kind of measures and rethinking about the way we are, the way we look at our region, the way we look at the issues of peace and prosperity, and do we really care for our people? Economists can keep fighting each other for this or that there is no fiscal space. There is always fiscal space if you want to create it. In a depression today, even if you create money, print notes, spend it, that will generate activity. That is how you came out of the Great Depression in the 30s.
No, absolutely. In fact, the argument for modern money theory and what Stephanie Kelton and Mariana Mazzucato are arguing in the recent past few years is exactly this idea of not being tied down by traditional notions of fiscal relations. Shandana, you had a point that you wanted to make, and then I want to take it back to Juvaria.
I just want
Please,
to say something here. The
please.
modern monetary theory in our context is being Islamized in a strange sort of way. I think we need an informed debate on that, because here is a theory devised abroad by Western economists, but is being gladly accepted by some of our obscurantist leaders. We need a different kind of debate on that.
I realize that I may accidentally be included in the group of obscurantist leaders, but I should fully and very robustly state that I have no such claims. Dr. Sab, I think you're right. I think we do need a more informed debate on that. But and maybe that's a topic for another day. But Shandana, you had something that you wanted to introduce.
So this is just I mean it's a logistical question that how are people crowding in to pick up the 12,000 rupees or the rations being given out, and I'm talking of since we're rural and especially remote rural areas, there's not enough supply of these things in the remote areas at adequate points where people can go and pick this up. So we are going to see this rush. There is also, we've had experience in past lending where we wanted to do cashless lending, which is part of our regular program, that we found that in some places we couldn't do that because the closest small shop to a woman client didn't even have enough cash to do that type of lending at that point for women to pick up this money. So I think that whatever system is being put in place, it needs better rural outreach for sure.
I think you're probably right. Although I think one of the arguments that would ensue after that would be whether the market is good enough for that, or whether mobile utility stores, vans, or other kinds of district administration devised solutions are the best way forward, or whether it's PPAF and the RSPs that are the best way forward, or whether it's the mosque and the madrasa network that is the best way forward, or it's a hybrid or a combination of all of those in terms of supply chains. Juvaria, maybe
just to add, Musharraf, I think because BISP is women-centric, BISP is about women. I think a lot of these options they exclude women, and we are obviously very keen that we partner with district governments, and I must say that district governments have been very forthcoming. In Sindh, our program is pretty much 100% women's program, and these women are sitting with district government at the table on committees, on task forces, facilitating the distribution of these things. So I think when we talk of mosques and other things, it's usually the men who will do that.
That's I think a very valid and important. No, it's a very important point. I mean, there's much to say on that in terms of the spread of the disease and other aspects of that. But I wanted to go back to fiscal, Juvaria, if you don't mind, and maybe talk to us a little bit about the fiscal implications of what we're talking about here, particularly Dr. Pervez Tahir's point. And I think Nazish alluded to it in passing, and I'll bring it back to her. But I wanted you to start off and talk to us a little bit about the political economy of how the country is supposed to fiscally reposition so that something like what Dr. Pervez Tahir is talking about is potentially doable in the future.
Yeah, I mean, there are a few angles to that, right? So I think Nazish's point about the universal basic income is really, really important, right? Because we don't, we have to sort of move beyond sort of our current contemporary sort of structures of how income is sort of distributed, how taxation works, right? And a universal basic income is essentially, it's a negative tax, right? So you have to sort of reconcile that the discussion about sort of Pakistan having a very low tax base and engaging in budgetary finance and so on with that, right? And I think what Dr. Pervez is talking about is it's quite a radical solution, and given the current environment, when you're sort of talking about cutting down the military budget and so on, right? But I think there are two parts to this, right? So one of them is if you have a universal basic income, like what is it? Like what are you talking about in terms of quantity? Is 12,000 rupees monthly a universal basic income? Is it the BISP amounts have tended to be smaller, so does that constitute a universal basic income, right? The other part is that for it to actually be a universal basic income, it has to be universal, it has to be given to everyone, right? And Dr. Pervez mentioned that, right, that if you're disbursing it to people who are affluent, that should be their choice, right? Are they actually going to claim it, are they just going to leave it there, right? And as Mudassar said, we actually have an infrastructure in place, right? So if you have 165 million SIMs, in theory it is possible to transfer an amount to those SIMs on a regular basis, and then people can decide if they want to keep it or not, right? Now the issue is from the fiscal side, that there's and again you mentioned modern monetary theory, but Pakistan doesn't fall into that category of a country that can use modern monetary theory, right? And we've already seen that every time the government has sort of
Juvaria, quickly explain why, because it has to do with monetary or currency sovereignty, but just explain for people
absolutely.
that,
So I mean, on a very the basic explanation is that Pakistan lacks monetary sovereignty, and to be monetarily sovereign, you have to sort of fulfill certain conditions, which Pakistan does. But the condition that they don't fulfill is that they're quite low on the currency hierarchy, right? And they're low on the currency hierarchy because there are lots of currencies that are stronger than them, and those currencies are stronger because Pakistani debt is denominated in other currencies, so primarily dollars, but also euros and also won. So if you have foreign debt, then you lack the ability to print your own money indefinitely. There isn't demand for your own money, firstly, and there's a very strong link between domestic inflation and how much money you print, right? Now that link is going to sort of be tested now in coming days, but and people are talking about, so those economists in India who won the Nobel Prize, Banerjee and Duflo, they just talked about how in theory India could have a universal basic income just based on monetary finance because oil prices are low, right? But there are other considerations also, right? And that just how Shandana mentioned that there are actual food shortages, right? So that's her defense of rations, but that's a very it's a real situation, right? That if you you can just print money. In theory, you can just give people of the private and public sector is, right? So when we talk about a universal basic income, to a large extent, we have the private infrastructure in place, right? So we have the digital infrastructure, we have this massive biometric database, we do have this ability to sort of just get people to open bank accounts overnight and then find like a certain amount within that bank account, right? But then what is going to happen when people actually start spending those amounts, right? Is the real economy in a position to sustain that? Is there enough food? Is there enough fuel? Are there enough basic necessities, right? So I think it is a little naive maybe to sort of focus the discussion just purely on digital infrastructure and financial inclusion and so on, right? There is a real role for the real sector in terms of commodities, but also in terms of just having cash available in remote locations, right? You would need the SBP to sort of step up and ensure that there is that every easy pesa point dealer has enough cash to sort of, and that requires coordination with the district councils and so on to see if there is, if everybody in theory did claim a certain amount, would there be enough cash at the local easy pesa?
Well, I think that's really interesting. I think it's a dose of reality, but I wonder if maybe, I mean, I'd like to contest it, but I think it's more important for Nazish to maybe weigh in on this. What is this idea of practicality and the role of, for example, government at the local level, in particular, district administrators, not just in ensuring, you know, supply chains, where I think they do have a role, but also in terms of what we were speaking about earlier, you know, who qualifies and who doesn't. Ultimately, I think on the SMS campaign, it's going to fall to district administrators. Nazish, do you want to just weigh in on this?
First of all, I want to say that, you know, a crisis like this or any other does kind of exacerbate pre-existing problems. So at one level, I'm glad to hear Shandana is saying that the local government system has been so switched on, because we don't really see much of that. So we do see a system that where the local governments across all provinces have been kind of disempowered over the years and are not as functional with the kind of vibrancy you'd want it to be. And that's unfortunate, because it's the kind of deepest extension of the state that's possible, in the sense it's the only mechanism we have for, you know, reaching the capillaries, so to speak. And, you know, I do want to say that the capacity of the state to kind of permeate across the country and the peripheries of the country has increased over the years. You know, every time you decrease the size of a district, what happens? There are courts that come up, there are police stations that come up. So what I'm saying is the assumption that, oh, the state is like this entity that can't get there is really not true anymore. With the CNIC, with the different institutions, we do have the mechanism for it. I do think the local governments do need to be empowered to function a lot more autonomously. Having said that, I do also think we need a better, more varied understanding of poverty. You know, there are some kind of images we have, these stock images we have in our head of what poverty looks like. And I think those kind of fall flat a little bit. So for instance, you know, I remember when the BISP initial thing was happening, it was like, oh, you know, in this house, there's a washing machine. So, you know, they're not the poorest of the poor. And, you know, in parts of Balochistan, you'd see people like storing food inside washing machines because there's a laborer working in Muscat who sent it back. And now they don't really know what to do with it because there's no water to plug into the machine. So anyway, my point really is that rural poverty is a significantly different thing from, let's say, urban poverty. And even within that, you know, what does poverty look like in the Badin or, you know, Makran coastal area versus how does it, you know, what does a green poverty look like? You know, in parts of Punjab, fertile areas, green areas, but there is an extreme level of poverty. I think our mental image, you know, for instance, a lot of focus has been in the past few years addressing, for instance, poverty in what is erstwhile FATA, for example. But the entire FATA, which we've had so many conversations about, is the entire thing is smaller than one district in Balochistan called Avaran. And we actually have no way of understanding the kind of incommunicable poverty that happens, that's, you know, in Avaran. So I think a better understanding and therefore more localized mechanisms. So just to respond to what Shandana was saying, you know, not having to, you know, roam around with bags of atta, it's a little problematic because there are no food shortages in this country. So even though it's a governance problem, we're not being able to get something there, but there's no food shortage. You know, even for the people who are living in these extreme areas of poverty, no one's starving to death. Unfortunately, we have, like I said, the stock images of what it looks like. Pakistan does have a malnutrition problem for sure, but we don't have people starving to death, not in this pandemic, but not prior to this pandemic either. So what are our, you know, I hate the word resiliences, but what are our mechanisms that exist? And, you know, poverty kind of gets drafted on top of it. So I think a more nuanced understanding and knowing that your distribution networks have to not just correspond to, you know, Pakistan in particular, but also within different areas of Pakistan, you do need to find different mechanisms about how our perception is, the public perception and the panic. You know, I think at some level we have to understand that the state really does function And it's critical for us to identify where it fails, for sure. But, you know, an example, if I pick up of the 2010 floods, in which when we look at the media profile, you know, everything was a disaster, people were starving to death, people were sitting on embankments. Whereas actually what happened was there were no secondary deaths. And in all floodings, people died during secondary disease, like, you know, outbreak of disease, for example. We didn't have any outbreak of disease. So at some level, you know, whatever allegations of corruption you throw at the PPP government, which was in power at that time, or talk about appropriation, we heard these stories, ki falana MP aata apne ghar le gaya, you know, so all these stories. So when you filter through all those, and look at the long-term data, the government did an excellent job handling the 2010 floods, and the data is evident now. So I think that a little bit of stock taking of what's worked, what's not worked in the past, but also understanding that the need for criticism is to improve systems, but not to stall at a rolling out of what's happening right now, because we don't have the breathing space. I mean, we can have this conversation here in Tabadlab, but the government needs to, because, I mean, what kind of contingency planning do you do for, you know, the world shutting down? This is not something we generally kind of take into consideration, and, you know, unfortunately, that's what's happened. So I think that it's important to roll these things out, to not get into, you know, the kind of ridiculous mudslinging that happens to be a characteristic of, I think, politics everywhere in the world. But at the moment, you need to reach out to those people. If things are going wrong in the process, you're making wrong, you know, if there's an error, if there are some people who are being included that shouldn't be, we can figure it out later. The bigger problem is what Shandana was saying, is excluding people, is if someone who's gotten left out. So if undeserving people are included, never mind that, we'll deal with it later. The important thing is to make sure there are no pockets that are being left out, whether it's in parts of, you know, deep pockets of Balochistan, which state has relatively low access to, you know, coastal areas, northern areas, whatever it is. I think that's something to panic about, not to worry too much about who else is coming into the fold who may not deserve it. Does that answer your question?
Well, I mean, I have so many questions, Nazish, but that's certainly an adequate response. I think, you know, just to add to the pockets of underserved or unserved, you know, human beings in this country, I think the one area you forgot, you know, it's always easy, not easy, but it's always, you know, we talk about remote areas or deep rural pockets. But in the heart of Karachi, you have undocumented individuals from various backgrounds. And you do have, now we have documented about 2.5 million people of Afghan extraction, but God knows how many others of a Bihari or a Bengali sort of tradition or background that don't have access to state services. And I think that was a point that was made earlier as well. I think it merits repetition. Look, I mean, we're coming up on sort of, you know, the upper limits of people's patience, and it's been such a delight to be part of this conversation. I wanted to go back to Mudassar, if you don't mind, and just quickly ask you about, you know, you've heard a lot about data, and I can sense even from this conversation, both at the government end, and you addressed that a little bit, that there is a maybe sense of discomfort might be the right word when it comes to adopting technology and digital solutions. I would also accuse, if people can tolerate that word, I would also accuse academics and civil society at large of also being reasonably suspicious about digital transformation and about data. And I think part of those suspicions or that hesitation is legitimate, because there are legitimate concerns about people's privacy, which was mentioned, I think, by Juvaria. But do you find that there's enough in terms of acceptability for what you are proposing and what clearly is the future anyway?
Can I also add something here?
Please, Dr. Saab, please add your question, and we'll ask Mudassar to respond to both.
I just want to say that this question of inclusion is becoming irrelevant. Those who don't have the SIMs, give those SIMs to them free, and see you have total inclusion. The question is it possible from your speaker, next speaker?
Those are for you, Mudassar.
Yeah, exactly. So I'll answer the second question first. So it's very easily possible. And I think this is the right solution. Those
So
who
what
don't
is
have a
the
SIM,
problem then? Everybody is covered. You don't even have to ask too many questions, you know?
that's a fair point. Absolutely. So it's
You are eliminating
the solution is right
bureaucracy
in front of
and that
us.
is standing on your way, in your way. Inclusion is not possible in the presence of bureaucracy we have. They always want procedures, systems that don't work. I mean, they got rid of local bodies and look what has happened here. The only system that could have worked in a crisis is not there.
No, agreed. So I think there's a lot of conversation that has happened about the universal basic income, and now we're talking about the potential of adding the people who are outside of the. I think it almost merits a separate roundtable on this because it's so important. But what's coming right on the heels of once we get past the COVID-19 issue is the very rapid takeoff of the fourth industrial revolution in the Pakistani economy. It's going to hit us, smack us in the face so hard and so fast that nobody I think ever expected. I mean, we thought that this will be a soft landing over the next 3 to 5 years, but I think it's going to happen now in a matter of months, based on what we are seeing in the services industry also. And this will not be only in the service sector, this will go into manufacturing, this will go into agriculture. So I think these kind of a basic living wage will be a permanent feature. It has to be a permanent feature in the government policy. And in terms of the, sorry, Musharraf, what was your first question?
Mudassar, I was asking about the degree of openness to the conversation about digital transformation. That's clear, and I think Dr. Saab has reiterated that in a manner that only he can. The bureaucracy and the state structures are resistant for many reasons. Some are legitimate in terms of just they don't know any better. And then some are, of course, having to do with, wanting legacy systems and the status quo to maintain and to continue. But I was basically prompting you or provoking you into maybe saying something about civil society and the academic world and the degree of openness on that end to this conversation about digital transformation. I feel like the problem isn't just in government, it's in civil society and amongst academics as well.
I think there are too many academic people on the panel for me to say anything insensitive in that regard. But I think it, frankly, if I may say this, that I don't think it really matters what the academia is saying. I think it's the will of the government, the need of the people, and the ability of the practitioners to deliver. I think that needs to converge. And academics are always on both sides of the fence. There would be some people who are for it and some against it. So, but I think the people who are for it, I think far outnumber the who are against it at the moment.
Right. We've lost video with at least a couple of our participants, which to me is just a signal that we've consumed enough of everyone's time. We haven't, I don't think, resolved any grand issues, but we've had a really rich exchange. I wonder, Shandana, you had something that you wanted to, I think, ask and also point out. So I wanted to bring it to you, and then maybe shortly after that, we'll close out today. Shandana.
Thank you. I think one of the your comment about civil society and IT in general, you're absolutely right. I think we're a big network, and we are so far behind even in our internal use and management of data. But I think there are obviously some things. For example, in this situation, the awareness raising about simple things like hand washing, etc., where outreach and what we call social mobilization is very key. And I think one good thing that's happened, and unfortunately it's been because of this crisis, is that the noose around the necks of INGOs and NGOs has been fairly loosened. Various permissions that were needed, etc., are not required. But this is going to after, inshallah, this is over, this is still going to be a problem. And one of the problems we faced before this crisis was the movement of money. Now, when you want to give grants and you want to give loans to the poorest, we have had big problems and have been in the conversation in 2 years with the state bank that these poor community groups have their own accounts and this is what the money is for. We are now checking every client against NACTA lists. So this whole atmosphere that FATF created is suspended right now, but I think that this is going to come back at us because it's linked to so many other things happening in this country. I can tell you that in Balochistan, where we have, thousands of groups, we're not able to open accounts for them. And we are currently trying to find a way out of that because of these other issues. The second point was raised by Nazish also. I think we mustn't forget that many districts of FATA do not even have internet. In some places, there's not even any PTCL connection. So while we're doing all this, I know the population is small and a lot of it is probably out of that area at this point. But we must keep in mind that that is a totally, black hole at this point.
I appreciate that very much. I think you're right. There's any of the black holes, the pockets, the unserved, the underserved. I think a crisis of this nature is an opportunity for us to re-engage and reconnect with those pockets, with those individuals, with those communities. I would reiterate, despite some of the criticism, which I think is perfectly fine. That's why we had this group, join us, and I'm so grateful to all 5 of you for taking out the time to have this conversation. But for my money, I think the speed at which these disbursements have been made, as I said, over 2 million households already served, does deserve, I think, special recognition. I think that it's a huge statement in keeping with Nazish, your point about the social contract and the state's relationship with its citizens. I think this is potentially yet another huge moment for us to recognize that there is such a thing as a state in Pakistan. It does have capacity, and it is okay for us to demand more and more from it, especially when it comes to the less privileged and the more vulnerable in our country. Juvaria, an absolute delight, despite it being the first time. It was a privilege. Mudassar, you, as always, very enlightening. Shandana, you are and remain one of my gurus. Nazish, thank you for enriching the conversation the way you did. And Dr. Pervez Tahir, it's always an educational experience engaging with you and hearing you speak. Thanks very much for joining us. I hope viewers will have learned as much as I did during this conversation, and we'll try to keep the conversation going beyond this instance. Thanks again, everyone, for joining us.
Thank you, Musharraf.
Thank you, Musharraf. All the best.
Everyone.
Thank you.
Stay safe.
Thanks. Bye.
Yes.